So to be honest with you, I never reached out before because just the concern of not having insurance and having to pay out of pocket, and then you're coming to me instead of me coming to you. So can you talk a little bit about that?
I mean, that's something that a lot of women are concerned about, and I often talk with them on phone consults prior to, just to kind of give them all those details and stuff. So a lot of people also worry about like time commitment, financial commitment, babysitters, but yeah, and so just overall worry about all that stuff. So if we think about if a woman struggles with incontinence, she's spending money every week probably to purchase incontinence products like pads. Well, research shows that women can spend up to $58,000 in a lifetime. And so that's a lot added up.
Right.
I mean, that's a nice car.
Right.
And then when you think about seeing me for pelvic floor physical therapy, relatively that's a really inexpensive cost and can lower anxiety because you're not worried about having an accident and just feeling strong and confident.
So what does that look like with you coming to my house to kind of work with me on my pelvic floor dysfunction?
Yeah, so I actually offer in-home and in-clinic sessions. So I have a clinic off of Forest Road. And so it just kind of gives the patient choice on where to be seen because sometimes people are more comfortable in one setting versus the other. I actually don't charge a concierge service fee. Everything's the same unless if you're greater than a certain distance, so which is really like over 20-25 minutes. So that reaches a lot of Lynchburg. Each session, so the first session is about an hour and a half to 2 hours long. I mean, I don't know anyone around here who provides that long of a session, physical therapy wise. You're usually going in and seeing a physical therapist maybe for 30 minutes, 45 minutes for the first session. And then after that, maybe seeing them for 15-minute follow-ups after that. So my follow-ups are an hour long. I'm able to spend one-on-one time 100% with that patient. And with that business model, I'm able to help patients get better faster. And so the average that I see patients is in about 4 sessions or less.
Oh, okay.
I also tell patients, if you're doing good and your symptoms are gone, I'm not going to have you come see me. You don't need to come see me so that I can say you're doing good. You'll know if you're doing good.
It just goes back to the investment piece.
Exactly. Like if they have those tools, then they're investing in something they can apply throughout their life. And then sessions are usually spaced out about every 2-ish weeks. It depends on patients, depending on what they're going through. But I have some patients that all they can do right now is once every month, and so we just modify it based on what the patient can do. Going back to that like financial piece too, there are many times women come to me and say, I just don't think I can afford those payments, and so I set them up on a payment plan, no extra cost. It just helps them pay at a slower time, something that they're more comfortable with, because I truly want to help people, but I also want them to be invested, because if you pay for something, you're going to own it way more than if you're kind of relying on your insurance to do it and then going to have somebody get you better rather than yourself better.
So it's very doable and it's flexible.
Yeah, it's doable, it's flexible. And I do my best just to give you as much information and tools to help yourself get better. So
that sounds great. I'll be giving you a call.
There you go.